Hi, my name is Jared Moss. I'm one of the urologists here at Regional Urology, specializing in male fertility. Today we're going to be talking about a male fertility or an infertility evaluation. Infertility is generally defined as either the inability to get pregnant or stay pregnant after a year of trying. It's important to know that infertility is extremely common. It blows me away that I see couples for evaluations all the time and they think that they're one of the few people that are struggling with this, and the reality is that they've had friends and family members that have struggled with the same thing. But the sad thing is, when it comes to fertility issues, is that a lot of times couples will suffer in silence. To illustrate that point, we now know that 1 in 6 couples will struggle with infertility at certain points in time. So that's an enormous amount of people that are sharing a struggle, but a lot of times not sharing that publicly or personally with other people to help deal with some of the stress and anxiety that can be caused by the inability to get pregnant. One of the most important things that I stress to couples and other providers is that anytime there's an infertility concern, it's very important to evaluate both of the partners simultaneously. It's important for the female to see her obstetrician and gynecologist and be evaluated for hormones, possible ultrasounds, make sure that she's ovulating and things along those lines. But before that couple undergoes more invasive testing or more expensive testing with the female, at the same time that the female is being evaluated, we always recommend that the male be evaluated as well. The reason for this is that men can contribute up to 50% of the time. 20% of the time we know that it's a pure male factor. There's no female factor involved, and maybe a male has severely low sperm counts. 30% of the time there's a female factor involved with ovulatory issues, irregular menstrual cycles, endometriosis, polycystic ovarian syndrome, something along those lines. And oh, by the way, the male also has some type of fertility issue, whether it be ejaculatory issues, semen analysis issues, and things along those lines. So it's just reiterating the point. Fertility issues are very common, and it's important that both partners be evaluated simultaneously. So you may be wondering, what does a male fertility evaluation consist of? So number one, it consists of a history and physical examination. I have a form that takes the female and the male's history. I go through that with the male and the female to make sure that I've got an adequate female reproductive history, as well as the males. I'm looking for exposure to certain chemicals, a family history of infertility, if they've had it in prior semen testing, if they've been taking testosterone, which is a big risk factor for infertility in men, as it causes decreased sperm production, if the male's ever had any surgery on his penis, testicles, if they've had hernia surgery. So that's just kind of a glimpse of what the history goes into. And then this will also be accompanied by a physical exam. It's very rare to see cancer present as infertility in men, but lymphomas and leukemias can certainly present as infertility. Testicular cancers can also present with abnormal semen parameters, and it's pretty rare, but occasionally I do find a man that presents for an infertility evaluation is actually diagnosed with a malignancy. So it's important not to rely on the semen testing alone, but also to have the male examined. Other things that we look for would be testicular abnormalities, varicocele. Varicoceles are dilated veins around the testicle. They're most predominant on the left. They're common in a lot of men, and not all varicoceles need to be fixed. But if a man does have a large varicocele and it's causing semen parameters, then they may want to consider a varicocele repair. Low testosterone is also a common finding in about 20% of men that are presenting for an infertility evaluation. So it's important to check a testosterone. I typically will check several other fertility hormones as well, just to see if there's any imbalances there. If there are imbalances that are found, is hormone manipulation going to be an option for this couple to try to help improve the male's fertility? Lastly, and most importantly, especially before any decisions are made regarding hormone manipulation or surgery or things along those lines, we always want to get semen testing. There's several different ways to do semen testing. We utilize our local sperm bank, where men are able to go and collect. We also offer other options where the men are able to collect at home. It's been great for a lot of our patients. It's very convenient. They can collect in the privacy of their own home. They don't have to take a day off of work. They don't have to schedule it. The preservative media is put back in the cup. It's then shipped overnight to the company. And then I get the results back along with the patients, and we sit down and go over those together. So to review, infertility is very common. It's typically 1 in 6 couples that are struggling with this. It's important to have the female and the male partner evaluated, both at the same time. The male fertility evaluation consists of a history, a physical examination. We do lab testing as well as semen testing. I will typically regroup with the couple after their first visit, typically 3 to 4 weeks after that, and we'll go over all the hormone testing, the semen testing, and then talk about what the options are and recommendations. I hope this video has been helpful. If you have any questions or concerns, please don't hesitate to reach out to us. Our telephone number is 318-683-0411, and our website is regionalurology.com. Thank you.